Boston Medical Center occupies a special place in Boston's healthcare. It is the primary hospital for urban Boston, and through affiliations with 11 community health centers and regional referring hospitals in New England, BMC cares for the most diverse patient population amongst Boston's many academic medical centers.
The patient diversity and complexity of cases we see at Boston Medical Center is the primary reason many of us came to train at BMC. It's also one of the reasons many of us have chosen to stay on as faculty. The diversity of patients allows for the exposure of a breadth of pathologies not seen in many academic institutions around the country. The clinical care at BMC is highly fulfilling and stimulating, and it's what our faculty and trainees cherish the most.
In addition to being the primary hospital for urban Boston and for most of the region's immigrant population, BMC has a preeminent reputation for clinical care and research in the following areas that have a direct impact on pathologies seen in nephrology training: acute kidney injury, glomerular diseases, systemic lupus erythematosus, amyloidosis, sarcoidosis, systemic sclerosis, and sickle cell disease.
Our reputation for clinical care and research in glomerular disease dates back to the 1970s. This is when Bill Cowser, who parenthetically later went on to become the ASN president and even later the ISN president, and David Salant, along with their laboratories, developed animal models like the Hayman nephritis model of glomerular disease to investigate the role of podocyte injury and other factors in human glomerular disorders. These decades of work on membranous nephropathy finally culminated in the discovery of PLA2R as the target antigen in primary membranous nephropathy in 2009. And needless to say, our laboratory and our clinical expertise continues to focus on membranous nephropathy. Given our long-standing distinction in the field of glomerular diseases, the Glomerular Disease Center at Boston Medical Center was established to provide specialized care for patients referred from nephrology practices across New England, as well as, of course, our own BMC patients first and foremost. Also, having an in-house full-time renal pathologist, Dr. Henderson, with expertise in these complex glomerular disorders and other complex kidney pathologies has really allowed us to promptly diagnose and institute treatment for these patients with a wide variety of glomerular diseases.
A lupus clinic provides multidisciplinary care to patients with various classes of lupus nephritis, and our second-year fellows have the opportunity to rotate in the clinic and learn firsthand the complexity of outpatient immunosuppression management and disease trajectory. Our lupus clinic participates in multiple clinical trials and has a lupus registry. These resources provide an opportunity for investigations for fellows interested in clinical research.
In addition to autoimmune glomerular disorders, Boston Medical Center is an international referral center for the diagnosis and treatment of amyloidosis and other paraprotein-mediated diseases. 3 of our nephrologists attend the multidisciplinary clinical practice and participate in research activities of the Amyloidosis Center. In recent years, our fellows have been very productive in amyloidosis-related research and have had high-profile publications along with national and international conference presentations.
We are also committed to caring for the underserved population in Boston. As New England's largest safety net hospital, we provide exceptional care without exception. Our research now focuses on improving the care of underrepresented groups and underserved populations. We are a site for the Kidney Precision Medicine Project, an exciting National Institute of Health initiative to better understand the molecular mechanisms responsible for the common forms of kidney diseases.
Boston University has been in the forefront of hypertension research since 1950s. We have a nephrology-led, multidisciplinary hypertension clinic within the primary care clinic setting that allows for evidence-based, timely evaluation and management of resistant or difficult-to-treat hypertension. Fellows in their second year will have the option of participating in this experience.
Our inpatient care model has distinctive features that allows for optimal care and training. An inpatient renal service is run by medical residents and exclusively cares for end-stage renal disease and transplant patients. This results in more patient-centric nephrology care and allows for a more seamless transition to the outpatient setting. A full-time renal PA supports our 2 consult services, allowing our fellows to more thoroughly think through, reflect, and discuss the complex cases we see here at Boston Medical Center.
We recently renovated our inpatient dialysis unit from a 6-bed unit to an 8-bed unit. This allows us to conduct more dialysis treatments throughout the day. We currently conduct anywhere between 300 to 500 dialysis treatments on a monthly basis. We have 24/7 nursing care available. We have nursing available at night, and they're on site all 7 days. In addition to intermittent dialysis, we also conduct continuous replacement therapy in the ICUs as well. These are conducted by the ICU nurses, and they can be done on a moment's basis. With all this availability, patient care is done timely in an efficient manner and done in a safe manner as well.
We started doing kidney transplant at Boston University Medical Center for more than 30 years. We have performed more than 1,200 kidney transplants so far, and we are doing close to 50 kidney transplants every year. Our team is composed of 4 transplant surgeons, 2 transplant nephrologists, and multiple coordinators, social worker, psychiatrist, and dietitian and pharmacist who work collaboratively in a multidisciplinary team to provide care to kidney transplant patients. Our fellows enjoy this environment and participate in every aspect of kidney transplantation, including donor recipients evaluation, caring for patients after kidney transplantation on the inpatient side and on the outpatient side. Our fellows have one of the greatest exposure to all aspects of kidney transplant care. They learn how to manage immunosuppressants and manage infections and rejections in our kidney transplant patients.
BMC is a very special place with exceptional faculty that provide compassionate care for all. Trainees here receive an extreme variety of cases ranging from critically ill patients with acute kidney injury requiring CVVH to very complex social situations that require interdisciplinary care models, all the way to second and third opinions for glomerular disease from around the country. So we very much look forward to welcoming you here to campus to see how we live by our motto, which is providing exceptional care without exception.
Come and join us. Have some fun.